is Rozz. Welcome to the DTAP podcast. I'm here with Dr. John from DTAP and celebrity stylist Martin Wong. Now, DTAP stands for Dr. Tan and Partners, and it's a GP Plus clinic with 10 clinics around Singapore. Now, Dr. John, I gotta ask you, what is GP Plus?
Okay, so GP Plus basically means we are a GP clinic, but we try and provide special interest care. We try and be a bridge between primary care and tertiary care, like your specialists, things like that. So we focus a lot on currently men's health, women's health, and sexual health. We've kind of tried to diversify and start going to allergy medicine, and recently as well mental health. So
nice. So it's like a souped up GP
outfit.
outfit.
We try and provide as many services as we can to really, treat and solve our patients' problems without having them need to go to see an expensive specialist and all of that. So
nice. And I like your vision as DTAP, to share medical information to the masses and make it as easily digestible as possible.
Yeah, we're trying to destigmatize healthcare, right? I think a lot of people in Singapore, in Asia specifically, a little bit more conservative, don't want to share too much about their health, no matter what age, whether you're young or old. Everybody's very conservative about it, so we're just trying to be a bit more out there, make it a little bit more accessible to everybody, and part of that starts with education and knowledge. So yeah.
So today we're going to be touching on a lot of a bit, touchy topics. Not many people are very comfortable to discuss this out in the open, but we're gonna tackle all that. Men's health and of course men's sexual health. We're going to be talking about the importance of a healthy sex life. We're going to be talking about sexual dysfunction, erectile dysfunction, premature ejaculation, STI screening, which is very important, and any stigma surrounding mental health.
Let's talk about cuckoo bird.
Can I just ask, how did that cuckoo and that clock become a nickname for penis?
No idea. Everybody knows cuckoo bird, right?
Yeah, even kids,
I've heard it since young. Yeah.
I've heard it since young.
I never understood it.
It's a child. It's a thing. But nowadays, I would say, in my patients and stuff, especially the expats, their kids are really well educated and informed about this stuff. Even 5-year-old, 6-year-old, 7-year-old, they're brought in with their parents, of course. But they'll say, I have a problem with my penis or with my vagina. Or they'll see a poster on the wall and go, is that a vagina? And they know, and they're 5 years old. And it's like, yes, it is. And so, they're getting more informed, but in a safe way. Safe way.
Not like the PP and that's your PP and your cuckoo and your number ones.
Jiao.
Yeah, we don't use these nicknames or so.
Part of it is starting the education early in a safe and accurate way. I think there's a lot of misconceptions surrounding sexual health.
What generation do you belong in? Are you a millennial? I think you would be a millennial.
I'm a millennial.
And I'm millennial. I should say my age. I'm 33.
Oh, you're so young. So the two of you are in your 30s. So I would belong to Generation X. So just to lay the groundwork here, to see which generations we're from. Let's dive straight into debunking some misconceptions, shall we? Let's talk about HIV misconceptions. Okay, having unprotected sex.
Okay, so the thing about this unprotected sex is, of course, if you can, always have protected sex. That's my view, right? But let's say one day, it just happened. So my friends, some of them have come up with this I had unprotected sex last night, and today I went for a blood test. And I actually don't think that blood test works. I gave them advice, but I say you better check with your doctor. I think there's an incubation period.
There is. So it's like COVID. Like any infectious disease, there's a window period, an incubation period for when a certain test can pick these up. So if I have somebody who comes really immediately after they've had this exposure, an accident, condoms break, condoms slip, or however it works, right? But if it's too early and you can't test, there are a few other things you can do. So, for HIV specifically, We have post-exposure prophylaxis. This is medication that you can take within 72 hours to prevent HIV transmission.
Right.
It's not just for sex, it's for occupational, exposures. So if I get a needle stick in a clinic, this is something that I would take. Yeah. But people don't know this and they're not aware, and then they may put themselves at risk. They may come either too early to test, too late for this medication. Testing-wise, for something like HIV, we usually recommend at least a month for really accurate results.
Wait, I just want to go back to what you said just now, Martin, like about how when you have unprotected sex, the next day, the first thing you think about is to do a blood test.
Yeah.
That is like, for girls, the first thing to do is like, I need to get like a pregnancy test. Or morning after pill, like not straight away into blood test. Yeah. Why is that at the forefront of your mind?
I don't know. I think that's one of the fears people have when they just, sometimes it's a
Are you talking about a specific group of people like LGBTQ, IA plus group?
Yeah.
Okay. Like specifically like homosexual men?
Actually not really. Even one of my other female friends as well. Like the next day, she's like, oh, I just met this guy on Tinder and we ended up a bit like tipsy and we had sex. Like, oh, but I don't know him very well. Maybe I should get tested.
Like a blood test?
Yeah, like a blood test.
I mean, blood tests are one thing. There's other types of infections. For guys, we do urine tests. Girls, we do swabs. But I think the overall thing is that, there are certain groups of people who are more anxious about these things. Sometimes it's definitely warranted. With Tinder, with dating apps, the dating scene has evolved over the last decade, like tremendously. And people are having more partners than before. So even though we say we're a bit more conservative, of course, if we compare to like, US or Europe or wherever, there has been studies to show we've been having more partners than before. People are settling down later. You don't have a single monogamous relationship for a longer period of time like we used to. So
I feel so left out. People are having more partners. I haven't had a partner since 2019. Wait, 2018? It's 2016. Oh my God, I haven't had a partner since 2016.
It's not a good or bad thing. We don't judge. It's
okay. Yeah. That's why I'm very healthy. Like whatever is down there, I've grown a new hymen and it's Gore-Tex down there.
Reform virgin.
Yes, reform virgin.
We say sex is healthy.
Yes.
So, for physical, for mental health, it's definitely something that people shouldn't shy away from.
Yeah, I don't want to shy away from it, Dr. John. I want
wasn't implying
to maintain my mental health also, but no options.
Very hard during COVID,
Yeah, because it doesn't make sense to me, number one. Like if we have to wear masks everywhere and then wash our hands before we touch any food, it doesn't make sense for me to go on a dating app and then have casual sex with someone.
Casual sex, then you have to do a blood test and a swab the next day.
They should do an ART before, maybe,
Oh my goodness. Okay, I'm trying not to let my emotions show on my face. Okay, so how long is an incubation period for testing? You said like the next day.
Next day is inaccurate. So that's why you're saying his friend was misinformed. But, for blood tests, especially serious stuff like HIV, we should recommend a month.
Yeah.
But, any worries, come and speak to a doctor. They'll be able to tell you, or hopefully they'll be able to tell you best.
Yeah.
I've heard some patients who say doctors have told them maybe not so accurate things. So again, it's kind of about seeing a doctor that's comfortable with dealing with these situations, open with it, and it's kind of a safe space to speak. I've had patients tell me that again, it's not just for men who have sex with men, heterosexual guys, commercial sex workers, that's another group of people that are really maybe marginalized, vulnerable. But we see both them or their clients, and it's just about education. So,
Cool. So you also mentioned, Dr. John, about this pill that you can take within 72 hours. So would you say that's the first line of defense? And then
the first line is prevention.
Yes.
Right?
Okay, sorry, my bad. Prevention is the first line of defense. Failing which, there's that pill.
Yes, it's like a course of antivirals.
Okay.
That's just for HIV. For other stuff, where I would say what they're more common, chlamydia, gonorrhea, I don't want to say too much, but they're essentially treatable. So we're not as
life-threatening.
You mentioned life-threatening. So again, with HIV specifically, we're really trying to destigmatize people, vulnerable groups, and I wouldn't say that HIV is even life-threatening now because treatment is available. Yeah. We offer treatment services or link up to specialist treatment as well.
Yeah.
And a lot of my patients who are HIV positive, they're living full, fulfilled lives. So it's not, again, that's part of the misconception to say, oh, this is a life-threatening disease. Yeah. Obviously, if you're not treated and you're not diagnosed, which part of the stigma, it makes it worse, makes it harder for people to get tested and get diagnosed in the first place.
So if you have taken this pill like 72 hours before having after
within 72 hours of an exposure.
Okay, and then do you still need to do a blood test a month later?
Well, yeah, we have to confirm that.
Okay,
that you're clear.
Are there chances that you might?
It's not 100%, but it's a very effective way.
Okay. Yeah. Any other like HIV misconceptions like we feel like we should debunk?
I also feel like there's this misconception that once you're on PrEP, you can go like have fun and do whatever you want.
What's PrEP?
Okay, so PrEP, Martin's heard of PrEP. PrEP is pre-exposure prophylaxis. So before we talk about post-exposure, pre-exposure basically means before you have sex, before you have an exposure, you're taking a tablet, usually daily, but there are ways to take it like event-based, on demand, they will call it. And that is also very effective in preventing HIV, as long as you take it properly before. And so what Martin was saying is like, there's this preconception that I'm taking PrEP, I can do whatever I want, right? In the community, that maybe people who are taking this, but it's very effective in preventing HIV. We really encourage it in people who are considered higher risk. Doesn't protect against other STDs. Even people on PrEP, we recommend they still get regular testing, regular screening.
And what is something like PrEP? Like, do you get
a tablet?
Yeah, so you actually go see a doctor and then you kind of...
Is it available in Singapore? It's not, right?
It is.
So
we offer PrEP. So there's various ways. Essentially, we offer like branded medication, from the company. Overseas, they do have programs with generic medication. So generics are like cheaper, but in Singapore, those are not HSA approved.
Okay. So you have to go see a doctor, like
you can get access to generics, like there's online stuff you can order, but you need to, or we highly, highly recommend that you see a doctor first, talk about it, get some blood tests as baseline, your kidney function, all that stuff. But
so it's like a holistic like care package almost. You have PrEP, and then hopefully you do protected sex. But and then if you're not on PrEP, and then
you have accidents, then you come and see us as well.
Yeah.
Okay. So there's all these like lines of defense. Yeah. Okay.
Yeah.
Okay.
So we've come a long way in HIV care, HIV prevention. So and part of it is really still through destigmatization, through education of people who need to know this stuff.
Yeah.
Like I'm sure you might know people who have never heard of this.
Yeah.
And still engage in high risk. Yeah. Kind of behavior.
Because like my idea was PrEP wasn't available in Singapore. That was what I heard. So that's why.
Yeah. Where do you get information from, like in with regards to sexual health, like within the LGBTQ community? Like, is it like I tell you, you tell your friend? It's like kind of like
usually hearsay. Even with usually it's hearsay.
Because like not many people dare to
talk about it in Singapore, I think.
So it's all like information from trusted friends, and then it gets passed down and might get diluted as well.
Yeah, accuracy of information. We hear all kinds of stories about what they thought was true, and in terms of availability of stuff, they thought they had to jump through a lot of hoops to get it, that it was illegal, that it's dangerous, that it's gonna, affect or damage their kidneys. Like these wouldn't be true.
Yeah, once you start taking it, you can't stop.
Yeah, which is not true, So main thing is we try to tell people just come and see us or any doctor, but obviously we know what services we provide, and just be comfortable speaking to your doctor. A lot of people, in Singapore don't have this like relationship with their doctor as somebody they would see even when they're well. Most people say, I only go to a doctor when I'm sick.
Yeah.
You know? But I think, especially overseas, there's more of that relationship with your GP, your primary health care. So we try and foster that with our patients as well.
Nice. So why do you think there is a stigma surrounding like HIV and sexual health in Singapore? Like why do you think it needs to be like a hush-hush thing? Is there a fear of being labeled?
I think generally in a more Asian context, talking about even just sex is not a very open topic.
You feel dirty talking about it?
No, it's more like a private thing. It's more taboo. Yeah.
Okay.
Yeah, and it's, you know, you live in like small household with your family. A lot of people in Singapore are living with their parents, right? You're living at home, right? Yeah. It's part of the culture. It's not wrong or right, but it also means you don't really have the freedom of expression, and you're not bringing people home, and you know, it's a different experience. So it's definitely more conservative.
Yeah.
I mean, the elephant in the room is the government does have policies, which we're all working.
A lot of space to have sex.
You know, and so we all try and work to destigmatize this stuff and try and get involved in like Pink Dot, that kind of stuff. But there's a bit of institutionalized stigma there, and we need to address that.
I mean, it's still embarrassing to buy condoms, you know, to go to 7-Eleven, but now you have like delivery services that actually go into convenience stores.
Yeah, sure.
I mean, there was one time, I feel so bad for the delivery guy, but it was one of those like stops where you can buy like from different shops within the mall. So there was like a pharmacy that was on the list, and then there was also like a juice shop, right? So I just wanted juice and bread from another bread shop, and then I needed condoms. and this poor guy was probably wondering why, who's this person that I'm picking this up for? You know what I mean?
It's interesting that you took on the role to buy the condoms, right? Like as the female.
Yeah. Obviously, it wasn't for me.
Yeah.
But still.
But like men can be embarrassed to buy it, and they'll ask their female partners to buy it. I don't know why.
Really? Why? You can tell me. You guys are men.
Yeah, actually, one of my female friends always buys the condoms. She's like, because my boyfriend doesn't want to go buy it.
Why?
Yeah.
Why do you
We're
think
more
so?
thin-skinned. I don't know. it's strange. But I've heard this a lot.
Yeah, because my female friend, she keeps having to buy condoms. And why do we always have to buy condoms when we go out?
Wait, so clearly I have two males in front of me now, and you're not giving me the answer that I want. Why? Do you buy your own condoms?
I buy my own. I'm married.
Yes.
But I do buy, I mean, if we need to use condom, yeah.
And do you buy your own?
Yeah.
And it's not embarrassing.
No.
And I was a teenager. Like, you just want to try sex for the first time and you think you want to be extra protected. You wear 2 condoms.
Okay, another myth,
That's horrible.
It's horrible.
It does not work.
It's going to increase the risk that it's going to break.
Yep.
But we still have grown men doing this.
Okay.
And asking us about this, and so condom education, that's the basic part of sex ed that we need to learn as kids in school, right?
Maybe you can do a podcast on that. Dr. John can teach us how to use a condom
You need
safely.
cucumber
with a cucumber.
Cucumber, carrot stick.
Sure.
Yeah.
Carrot stick?
For different sizes lah.
I mean, they're
Stick or full carrot?
Carrot stick, full carrot, cucumber, zucchini, cocktail
Eggplant,
sausage.
eggplant, right?
No.
water bottle.
Yeah.
Okay.
All sizes, no discrimination. No, but no, you did also say, like, you know, sometimes like condoms get lost, like they come off.
They'll come off. They'll slip.
They get lost.
I don't know if they get. Do they?
I guess
Sometimes. Okay.
You get lost where?
Sometimes they do get lost.
Okay.
And I do get patients coming in saying, we had sex, my partner had a condom, and then we couldn't find it afterwards.
Yeah, it must be.
Please check.
Yes.
So we do check. Both, whichever place we need to check.
Nice.
Yeah, it does happen. It does happen.
Okay.
Wow.
So.
I wonder in what situations they come off.
Okay, I can
That's
tell
for
you.
another podcast.
I can tell you, it's gonna come off if the guy loses an erection.
Yeah, and that's what we want to talk about today as
Yeah,
well.
okay.
Erectile
Segue.
dysfunction. Yeah.
Yeah, but obviously, you know, when they lose an erection, the condom is going to become looser and comes off, and it's a problem. Happens a lot.
And how do you solve something like erectile dysfunction?
Okay, so there's lots of reasons this affects guys, right? There's age-related changes. There's like medical conditions, people with diabetes, high blood pressure, smoking. All of these increase the risk of guys developing ED. Then there's the kind of stress and psychological conditions which can affect it. A lot of guys tell me that, they get a lot of performance anxiety, maybe new partners, maybe old partners that they're not as interested in, sexually anymore, right? So we have to have a frank discussion in the clinic and really try and figure out, is there an underlying cause? And then obviously treatment is tailored to that. But there are treatments for sure.
Do you have any experience, friends or anything with ED?
No, I only remember watching American Pie.
Okay.
I don't know if you guys watched it.
No, I have not watched it.
He took one too many Viagras and couldn't go down because he couldn't get it up.
Oh yeah, that's the other part of erectile dysfunction when it doesn't go down.
So if you have took Viagra from not so legitimate source, there's a lot from Thailand. They go there, bachelor parties, whatever. You can have risks of side effects that you wouldn't like. This we call it preepism. Basically, when the erection is too hard, doesn't go down for hours and hours and hours.
And you have seen patients like that?
Yes, but not recently and not too frequently.
Yeah.
Okay. Yeah. But like Viagra would have been the first one that came out on the market like 1998. We've got lots of different options now. They last longer, they have less side effects. We have certain procedures like this kind of non-invasive stuff like shockwave therapy. Sounds scary, but it's not. It just stimulates the blood vessel growth. Various things.
My chiro's been doing that to me, shockwave therapy.
On your penis?
No, on my back. On my lower back.
I literally
doesn't hurt, right?
Don't
Doesn't
have that
hurt,
appendage
doesn't
there,
hurt.
but I'm
Doesn't
feeling
hurt.
all sorts of feelings right now.
I've done it on my lower back, not on my
Okay.
penis.
It doesn't hurt. It's low intensity.
Okay.
And it stimulates like the blood flow.
Okay.
All right. Same thing for to heal your back, because you need like blood flow. It brings all the kind of healing factors in your tissues. So we do that for older guys as well, especially if they're smokers and stuff, and their blood vessels are not so healthy.
So there are treatments in place for that.
Yes.
For erectile dysfunction.
Yeah. And
they're long lasting.
depends. Some are on demand, like pills. Some are like the shockwave therapy. They last longer.
Okay.
Months to 1 year. 2
So that
years.
the penis will be like functioning normally with that treatment, without like pills.
Hopefully
Okay.
we can improve it. Obviously, big spectrum. So
I'm very concerned about, I'm asking all these questions about penis and I don't have one. Is there anything you want to ask? Like maybe bring up? He's perfect. He's a Greek god.
you know why?
Mine works.
It works. Yeah. But as you age, so the statistics are that like by the time a guy is 60, or at least 40% of guys up to the age of 60 have experienced ED at some point.
Yeah.
Okay.
Whether it's acute from like acute stresses, we're working from home, burnout, can be alcohol, can make it harder to work.
Yeah.
So it's a big thing, and it's much more common than people realize.
Yeah.
So we just want to make sure that everybody is aware.
And what about PE? I'm just going to give these like acronyms right now. Premature ejaculation. Is that a common problem amongst men in Singapore?
We see patients for premature ejaculation all the time as well.
How can you tell when it's premature?
Okay, good question.
Yeah.
Different guidelines will have different definitions, right?
Okay.
The consensus is around from the time of penetrative sex to ejaculation, about 90 seconds. Some will say less than 2 minutes would be considered PE.
Okay.
Then you have some guidelines out there will say, as long as it's shorter than what the guy wants, we can call it PE.
Okay.
So I'll have like patients who come to me and go, I have PE. And I go, how long do you last? Like 15 minutes. I'm like, oh, that's
I'm stunned.
That's not bad.
That's not
bad, but
I'm
okay.
sorry, I'm speaking up for girls. That's too long.
Yeah.
That's too long.
So most of that's not as frequent. Most guys who do a PE, they'll come and say, I only last short time, 60 seconds, 90 seconds. We have treatment for these as well.
Okay.
Yeah.
And what would you recommend?
So it's
Are they
usually
long-lasting treatments as well? It's just like
there's on-demand medications, tablets as well that you can take before sex.
yeah.
There are certain exercises that we'll recommend. So like pelvic floor type exercises.
Yeah.
Specific ones they call like start-stop technique or squeeze technique. So people can look that up and see.
Yeah.
And if it's something that we feel is a bit more, maybe there's a bit more psychological reasons for it, then we can always refer to like a specialized sex therapist or counselor. So we have a good network of people that we work with as well.
Yep.
So we try and solve all these problems.
Yeah, so I think it doesn't only happen, I mean, it could be low sex drive as well, but also because I have had friends, I have this female friend that says that, her husband and her don't have sex because they live with the kids and the helper and they have this irrational fear that they can be heard outside the room.
Oh.
So they just don't have, just to make it convenient, so no one hears them.
Wow.
So
Yeah,
never.
so-
What about soundproofing
Well,
the walls?
kids are very, like once kids come along, it's the most common reason that
Yeah.
we see couples have a reduced sex life. Right?
Their roles change into being like providers for the kids.
And part of this is natural. But we also know from longer term studies that a healthy sex life is really important for couples. So they have to make time, you have to book a staycation without the kids, send them to grandma's, that kind of thing. Yeah. So
I send them to grandma. That sounds like what you do.
We're going to grandma's again.
Grandma. After when they grow up, like grandma equals mommy and daddy time. Cool. And how? I'll ask Martin and Dr. John as well. Like from birth perspectives, do you feel like people going to get STI screening in Singapore is still a little bit taboo? Because we do health screens. That's like, we can tell our friends about it. I'm just going to get my yearly health check done. But specifically like STI screenings, you don't talk about it, right?
yeah.
I think even when you do a health screening, there's an option to opt out for screening of STIs and HIV, Which I find, because recently I went to get a blood test and my doctor was like, are you okay that I include the HIV? I'm like, yeah, of course, why not?
Yeah. HIV specifically, the reason that they have to mention this is because it's still a notifiable disease in Singapore.
Okay.
That means if you test positive on a lab test or at a regular clinic, MOH needs to get notified.
Okay.
And that's part of the policy here.
And what happens when MOH gets notified? Does it affect your work? Or?
It's by right not supposed to affect work or anything, but there's some contact tracing going on. There was the case a couple of years ago that registry leak. Do you remember the HIV registry leak?
Yes.
And that's a really big, it's terrible. Like objectively terrible thing, should not happen.
And people have lost jobs
And
as a result?
no, they haven't, but they've lost the trust in the system, especially anything government related.
Yeah.
So we do have, on that note, I run the Robertson Clinic, which is like an anonymous HIV testing clinic.
Yeah.
And there's a few other clinics doing anonymous testing. You have to be picked by MOH to do anonymous testing for HIV. So that one you can come and you can test anonymously. You don't need your name, don't need any details, not notified even if it's positive.
Yeah.
But people don't know that. Now, apart from HIV and syphilis, and they usually include some of these in health screening, there's a lot of other STDs that are not included. So those are the ones that people need to be aware of.
Yeah, and especially when men are carriers for some of the diseases that women actually suffer, like the HPV virus and stuff like that.
Both sides, because but HPV is very, very common as well. That one we vaccinate.
Or I just not have sex. That's what I tell my gynae.
You
It's
should
like,
work for MOH.
I know, I should. And like, a part of me is bitter that I am not, and then a part of me is like happy that I am. like my gynae would tell me like, hey, you want to get this vaccine for the HPV?
Don't need.
I was like, no need. I haven't had sex. What?
Yeah,
like,
but
hello.
you should though.
I know I should. Next year. 2022 will be the year of reckoning for me.
Sexier.
Yes, I got my dress ready. I've got all my tools and like.
You got the lingerie.
Yeah, I've got the dance ready. Like it's all happening. It will be all on my Instagram. Trust me on this. Of course, like, you know, to complement like your sexual health and you know and all that. Like, I think it's important as well to take care of your body so that, you know, whenever you fall sick, you can heal faster as well. And I know, Martin, you are. Can I even say addicted, like, to exercise?
I'm addicted, I think.
Let's talk about this.
Yeah, I need to go for AA.
2 to 3 times a day, every day a week. Is that
Every day,
correct?
yes.
I'll leave you guys to talk about this. I reserve.
I wish I had the time to do that. But yeah, I mean, physical fitness is obviously a huge part of your life. And great. That's why he's got no ED. I mean,
Wait, is there such a thing as too much exercise?
yeah, I mean, okay. When it comes to addiction, anything that we term medically as an addiction, I guess, technically not the healthiest.
Yeah.
What constitutes an addiction?
I mean, if it's something that you're obsessing over, if it's something that, you know, if it's affecting different parts of how you function in life. So it's more about whether it's functional or dysfunctional. It becomes an addiction when it's dysfunctional. When you say, no, I can't do this or that because I need to do something else. Whether it's
Is it there?
Okay, then I don't feel so bad now. Maybe
Yeah.
I'm not addicted.
Maybe you're not addicted.
But maybe I am.
Okay.
I don't know.
extremely enthusiastic.
Yeah.
Yeah,
okay,
maybe you're
okay,
extremely enthusiastic. And you have like all these fitness apps that you use as
Yeah.
well, right, to help keep track
So
of your...
I've been using the Lumi Health.
Okay.
Because I'm very anti. Like, it gives me like vouchers, HPB vouchers.
I love it.
What is
I
this
mean,
Lumi thing? Like, is it attached to a company brand?
Lumi Health, right? Your Apple
Yeah,
Watch.
Apple Watch.
So Apple kind of has this thing with HPB, Health
Yeah,
Promotion Board,
Okay.
to try and like encourage people to exercise.
And you get vouchers from it?
Yeah.
Oh, I didn't know that.
Yeah,
Clearly,
I've
I'm not
claimed,
wearing the
like-
exercise
I've
watch.
claimed like $100 from cold storage.
Me too.
Yeah.
Free detergent to wash my smelly clothes.
What?
You don't
Condoms?
even. You know what? You don't even need to like do exercise to get points.
You just need to walk,
You can
stand up.
you can just say that you slept well. You can
Yeah.
say that you ate less carbs.
Wow.
And but I mean,
Balance your plate.
yeah, you should try and do it though. Right?
Oh, yeah. Oh, my goodness. All these loopholes. Look at these guys. They're more auntie than aunties I know.
Yeah.
This is crazy.
Lumi Health is great. I mean, health apps overall, like such a big change in the last decade. All these wearables,
Yeah.
tracking, and then, you know, people like biohacking their health, trying to figure out how much sleep they need. Do you measure like your HRV?
Yeah, I do.
What is HRV?
You can,
The heart rate is
variability. Heart rate variability.
Yeah.
Yeah.
It measures my what's that? The oxygen level in your blood.
Is that accurate, though? I've always wondered about that.
The oxygen's pretty accurate, I
Yeah.
think.
Okay.
Yeah. But like people are getting all these parameters and really educating themselves on how to take care of themselves better.
So that when they come to see you, they kind of already...
Yeah, some
sort
of them
know.
have like a spreadsheet and go, you know, this is, I wear, let's say they have an Aura ring. Have you heard of the Aura ring?
Yeah.
Like to track your sleep and everything throughout the day. And they'll be like, I slept this much and this much, but this day I was really stressed at work and then I found out I couldn't sleep. So we work together with people on all that, but you know.
So, you know, something interesting about the Apple Watch, right? I went to Sydney one year to help a friend adopt a dog. Like, she was buying a dog, so we went to see the dog. So I met this like 80-year-old lady that was like part of the house that was breeding the dogs. And she said that, she uses an iPad. Like for someone 80, iPad, she has a Mac.
She's 80 years old.
Yeah,
Okay.
and the Apple Watch. So I asked her, like, why do you have so many Apple gadgets? She's like, because I bought the Apple Watch for my own birthday 2 years ago, and it saved me from a heart attack, because the Apple Watch was showing her irregular heartbeat, and she was
Wow.
wondering, well, maybe this watch is wonky.
Yeah. Oh.
Yeah, so she went to return it to Apple, and they said no, the watch is fine.
You're
And she went
having-
to see her doctor.
Yeah. Well, we're advertising for Apple, but
Yeah, I know.
Yeah, I know. I mean, I just
Bring
want
in
to.
some money.
I just want to like just get like a doctor's like word on like these health apps within the watches. It's
health apps
It's legit.
It's legit, and a lot of people could come to me for maybe they come for like weight loss, right? Weight loss is a big thing, and I usually do tell them to go download certain apps, help to calorie count. Is it people have like a taboo about saying calorie counting because they say, oh, you shouldn't worry about what you eat, what you do. But at some level, it's important, especially if you are very overweight. Like that's the base. I need you to know actually how much you're eating and putting into your body.
Basically, help you.
Yeah, and not again. It's not to obsess over it, and it's not. I'm not talking about the other end of the spectrum. People who do have problems with obsessive eating issues, which we can try and help with, and who are losing weight even though they don't need to, but really guys who are overweight and they're eating like 4,000 calories a day and they don't realize it. So like apps like these are very useful.
Nice. Well, this is like there's so much to talk about, these two topics,
health.
but we're just basically just touching the tip of the iceberg. So much more to like discuss. Clearly, like very, very short for time. We have absolutely no time left, but we want to keep the conversation going and open. Are there like platforms that we can reach out to, like people can reach out to for like questions or to further the conversation?
I mean, you can follow us on Instagram, like at DTAP Clinic.
So people can drop you a DM and go like, hey, and then you guys answer?
I think we have a team, but obviously if it's like specific medical stuff, it's important to arrange a proper like consultation, but we do teleconsultations.
Nice.
So just to set up with that. And we have websites, you can reach out. We have a couple of YouTube videos out there trying to educate, things like that. But everybody's different, like everybody's health has to be individualized. What works for you
might not work for you.
Might not work for you. So speak to a doctor and hopefully like see a doctor as somebody you can approach. Not some, old uncle. And I'm sorry, no, I'm not. There's nothing wrong with that. You can
I feel attacked. like this age thing, you millennials.
But it should be somebody you can approach. And just chat with. And it's not somebody you just go to when you are sick.
He seems friendly, right? Yeah, seems pretty cool.
Friendly.
Yeah, you seem pretty
First time
nice and
meeting,
approachable.
so yeah.
Nice. Thank you so much, Dr. John.
Thank you.
And thank you so much, Martin. This has been the DTAP podcast. I'm Rozz, signing out.